Hello again, Dr. Mike here, continuing my series of brief videos on chronic physical and chronic emotional pain, and especially on how to eliminate chronic physical and chronic emotional pain. In today's video, I'd like to speak about something I haven't mentioned yet in this series, specifically what I call chronic stress illness. When I say chronic stress illness, I'm referring to any type of chronic physical symptom or physical syndrome where it turns out that the physical symptoms are actually being caused by stress, tension, or uncomfortable emotions. Now, keep in mind, with most types of chronic physical pain, especially when it's what we call musculoskeletal pain, like pain of the muscles, the joints, the tendons, the ligaments, or even chronic headaches, for example, back pain, neck pain, fibromyalgia, chronic tendinitis, chronic neuropathy. Most of these things respond best to the Zero Pain Now program, a mind-body program. But there are certain types of stress-caused physical symptoms that fall into a different category, like chronic chest pain. It's not something we typically deal with Zero Pain Now, or chronic diarrhea. It's not a pain at all, it's a diarrhea, or chronic dizziness. So these things might respond to the Zero Pain Now program, but the program wasn't designed for these. So if someone has this type of manifestation of stress, and I don't feel they're necessarily a candidate for the Zero Pain Now program, then I'll do a chronic stress evaluation. This is basically where I would sit down with you, either by phone or by Skype or in person, and I would be like a detective, and I would ask you questions about all types of possible stress in your life. This could be stress that you're having now. This could be stress that happened when you were a child because of a difficult childhood or even abuse, or it could be stress of an early relationship in your early 20s when you were married to someone who was really not a good, healthy partner for you. So any type of life stress can cause physical symptoms. So I'll sit down with you, I'll do this stress illness evaluation, I'll be a detective, and I'll figure out which types of stress or specific stress is leading to your symptoms. And once I do that, I can give you very simple but powerful techniques to basically reverse that stress. Sometimes it involves journaling about your emotions. Sometimes it involves setting time aside in your life to take care of yourself and not just take care of others. But basically, I would let you know which stress or stressors is likely the cause of your physical symptoms and advise you as to what to do to reverse that stress. And then over a short period of time, if I'm correct, we'll see those symptoms go away. So how do you know if you're someone who may qualify for a stress illness evaluation? Well, first of all, you should be having the symptoms for at least a few months. If it's less than that, you really haven't given your regular doctors enough of a chance to find what's going on. Also, you should have seen at least a couple of general doctors and at least 2 or 3 specialists. The bottom line is you want to have had a pretty comprehensive physical workup with blood tests, x-rays, MRIs, whatever is appropriate, to make sure that there's not a physical cause for your symptoms that your doctors can find. Now, if you're someone where your doctor says, I've done everything I can't figure out what's wrong with you, you're exactly the type of person who most likely is having physical symptoms from a stress illness. So that's the criteria. If you've been having symptoms for a few months, if you've seen at least a few doctors, including 1 or more specialists who can't figure out what's causing your symptoms, and you feel that you may have some stress in your life, or you may have had a stressful childhood or have had a very stressful relationship either now or earlier in your life, if any of these apply to you, then there's a very good chance that a stress illness evaluation done by myself would be able to figure out what stress is causing your physical symptoms and eliminate it for you. So that's another type of thing, another way that I can help you.